Hello everyone. Questions were quite nice. And I'm going to talk about the contribution of supplements in the treatment of ADHD. Why should we treat ADHD? Because the prevalence changes between 5% to 10%, and also in 65% of the cases, the effect still continues. NICE guideline tells us that multimodal treatments are currently recommended. So how can we use non-pharmacological approaches? Because it changes patient to patient. So when is the right time? When treatment response is small or no, or there's no support, when there's severe side effects, when there is no response to treatment, and also we should evaluate the effects in the long run. So what are our non-pharmacological treatments? On one hand, we have exclusion and diet. On the other hand, we have restricting treatments. On the other hand, we also have psychosocial approaches such as behavioral interventions. I would like to talk about diet. There are studies on the role of etiological factor of diet, and then some recommendations about alternative treatment. Diet were suggested. We have two types of diet. One is restricting diet, and then we have supplementary diet. Two different types of modality we have here. When you check PubMed, you see for ADHD we have nearly 35 studies. When you check diet part of those studies, you only have small part. In a wide spectrum, not only treatment but also the role of diet in prenatal period, also some lacking, deficient substances in ADHD diet. You see there is 166 studies, but all of them are different. So what about supplementary treatment? We have 167 studies on PubMed. Here you see clinical trial data. You see the distribution according to countries of the studies. Over 1,000 studies we have. But in specific terms, we have only 49 studies. Turkey is represented in the orange region. But when you check in our country, we don't have any supplementary study about diet in our country, Turkey. So we lack a lot in this field. Maybe just like neurofeedback and family treatment, we should also focus on diet. We have two types of diet treatment. On one hand, we have supplementary. On the other hand, we have restricting approach. Supplementation with omega-3 and omega-6 fatty acids is used. Omega-3 is most commonly used one. We have PUFAs in 35 to 30% in the brain. We have ALA, APA, and DHA. All of them are essentials. Because they are not present in the body, so we need to get them outside. You see, omega-3 fatty acids have inflammatory effect, anti-inflammatory effect. In studies you see that high omega-6 in tissues, omega-6 increases when compared to omega-3. So it leads to neuroinflammation. In patients with ADHD having behavioral symptoms, omega-3 fatty acid concentration was found to be low. You see a study here. It's a cohort study. Even in prenatal, you see in cord plasma, omega levels were checked. So we see the unsaturated fat acid rate is still present even before prenatal phase. When we look at the market, there are lots of products for omega-3. I mean, we have gels, capsules, and fluids. So, in most of products, APA and DHA were found in different values. When we check the efficacy in ADHD symptoms about omega-3, we have controversial results. We have two meta-analysis studies. Here, meta-analysis says that if we add omega-3, we have a small significant effect as a result of the study. But the more EPA increases, the more efficacy increases. It is not correlated directly with the result of the study. Maybe along with methylphenidate and the other agents, we can use it as a complementary treatment. Meta-analysis tells us that if you want to give omega-3, you should give it in high doses. Another meta-analysis treatment about non-pharmacological interventions for ADHD. Conclusion is similar. We have small but significant findings in the reduction of ADHD, but it doesn't mean that it can be an alternative treatment. This is another study. Connor's rating scales were concerned. Generally, we have a decrease in Connor scores, so it's not statistically significant. But in the former study, we have small but significant result. But this is quite the contrary. So omega-3 is given as supplementation, but it was supported by a few studies. Another study here. So in the study, again, there is no statistically difference. Another diet study. When you give fatty acid, when you add fatty acid in ADHD, it still protects the uncertainty of clinical importance. So the combination, I mean the omega therapy as combination is suggested and highlighted. Omega-6 and omega-3 are used in different periods. I mean, there are lots of differences between meta-analysis, but also we have some limitations. So studies do not support the use of fatty acids instead of pharmacological treatments, which are standards. And also the plasma levels leave question marks in our minds, and we don't have any effective long-term studies about this. Omega-3 supplementation has some criticizing. Follow-up is a concern because also it should be continuous. And also we need to check them carefully with methodological restrictions. I will also talk about supplementation with micronutrients. We have coenzymes, cofactors, vitamins and minerals. There are some cohort studies here. And also they say that academic success is related to what you eat. So if you have a good diet in the childhood period, then you will have a better development. And in some psychiatric disorders, in the etiology, in vitamins and minerals, we see some changes. And with micro supplementation, we can create solutions. There is a wide spectrum about serum, zinc, and we have zinc, iron, minerals. It's a wide spectrum. There is a zinc study. In the study, 48 pediatric patients was found to have low levels by 30%. The outcomes are changeable, and we have lots of products. I mean, single studies were conducted, but we cannot just standardize, generalize those studies. All of them are specific. And also, lots of different outcomes that we get from the studies. Use of nutritional supplements in youth. The study is about data from 4,067 children were included. We didn't see any significant difference. I mean, when you add nutritional supplements, again, we didn't get any significant difference in ADHD treatment. So, we need to carefully research the use of nutritional supplements in ADHD treatments. And also we need to inform the patients about the efficacy. Another zinc study. In ADHD, there were some differences found. Another adolescent study that I placed here, response rate was handled in this study. Interesting results. In adult patients, we have low D vitamin values, but it is not the same in all cases. Zinc, B12, iron and folate that we cannot correlate with the result of the treatment. Again, another supplement studies for pediatric patients. We have a limited value in the use of supplements, so we cannot use it as a main treatment. Also, there's another study which has a interesting result. Medication-free children were included for vitamin mineral treatment, and as a result, it resolves attention problems, but there is no improvement in hyperactivity. Also, emotion regulation can get better. You see, problems regarding attention and emotion regulation is good. You see the side effects. We don't have much information about side effects in pediatric patients, but we have lots of them in adults. There are headache, dry mouth, sleep disruptions, anxiety, and eating disorders. And some say that it is not related to side effects, so we have lots of limitations about side effects. In the market, we have lots of products. We targeted wide spectrum approach. In terms of effect, we have low rates. Also about micro diet, we didn't see we couldn't find the exact relation between the component dose and variety in ADHD. I mean, in most of the studies we have mega dose use, so we are not much informed about toxic effects. I don't know how much time do I have, but I would like to briefly talk about something. And also we have in ADHD we have restricting treatments. We have artificial nutrients and also stains. We have Feingold program, and those additional sweeteners, additional substances, all of them are eliminated, and then we follow up the patient. Those are serious elimination diets. When you check the efficacy, you see in family reports we have small effect, but in teacher reports we don't have any significant effect. Elimination diets are quite heavy, severe programs, so patients expose a very small amount of nutrients. We also have oligoantigenic diets, and here it covers allergens like milk and meat and cheese, and we have IG oriented immune mechanism, IG mediated immune mechanism. You see diet affects ADHD and behavioral disorders related to IgG level. And we also have limitations about the test because it is not nutrient specific. So we don't know which nutrient we should eliminate. So those kind of diets are not that much recommended. For future research, it is recommended to focus on intestinal microbiology and brain relationship. We should question microbiota. It is emphasized. As a result, psychological treatments and diet approaches are used in the treatment of ADHD. which are non-pharmacological, and we lack in methodological studies. We need to go for an individualized approach in the treatment of ADHD. Thank you so much for your